The first symptoms that will help you know if you have ulcer is a stomach pain. The pain is typically felt in the region of the stomach that corresponds to the position of the stomach or the duodenum. I talked about the duodenum in my last video. That's the part of the intestine that adjoins with your stomach. So I'll be describing this position now. As shown on your screen, if you divide the stomach into 9 regions, the pain is usually felt in the central uppermost portion, which in our medical jargon we call the epigastric region. So we talk of an epigastric pain for peptic ulcer. The pain at times can also be felt at your left uppermost portion of your stomach. The reason is about the position of the stomach and the way it lies. It lies and slants leftward. So in summary, that pain can be felt either in your epigastric region, which we call the central uppermost portion of your stomach, or the left uppermost portion of your stomach, assuming you have divided the stomach into 9 regions, by imaginary line. Pain is often described as burning, or peppery, or gnawing.
Wow.
The pain can occur shortly after meals if the ulcer is in your stomach, or about 2 hours after meal if the ulcer is in your duodenum. That's the part of the small intestine closest to the stomach. The pain at times may awaken people at night.
Oh, yes.
And it's not uncommon to have patients describe that they feel the pain to their mid-back.
True.
The pain extends or radiates to their mid-back. The pain may be relieved by an antacid. That's an over-the-counter, chewable or liquid drug that neutralizes acid in your stomach. And that could add up. If you are thinking the stomach pain you're having is an ulcer and the pain is relieved within minutes after taking the antacid, that may portray the fact that your stomach pain is an ulcer pain.
Oh, really?
Sometimes the antacid may not be able to deal with it, especially when the sore is very, very severe. In addition to the stomach pain, there could be other symptoms related to the digestive system, such as nausea, that's the feeling of vomiting itself, a bloating feeling, that's very common, or a feeling of fullness, belching, and at times passage of watery or loose stool or frequent stooling. And then there could be appetite loss. When your doctor examines you, there will be pain in the stomach region that we have described. Oftentimes, your doctor may not need more than these things that we have described to make a diagnosis of a peptic ulcer disease.
Oh, really?
That is the characteristic upper abdominal pain and tenderness, pain. After when your doctor examines and presses your stomach, that pain in the region that corresponds to the stomach may just be enough for your doctor to tell you that you have a stomach ulcer. Let it not surprise you. Some diagnoses in medicine are mainly clinical. In other words, the doctor may not need to ask you to run several tests before it can conclude that you have that condition. So you don't go ahead, argue with your doctor if he tells you that you have ulcer based on the findings that you have described. Some will say, but doctor, you haven't even run tests, you haven't even done any tests to confirm it.
Yes.
If the doctor is going to ask for a test to confirm that diagnosis, it will have to be a test that can look into the inside of your stomach. And that test is what we call endoscopy. Endo to mean inside, scope to mean look into.
Wow.
So endoscopy is a test that is used to view the inside of the guts, of the bowel, stomach, and what have you. The test is not routinely done. 1, it's not readily available in this part of the world. 2 is that it is invasive. In other words, it involves entering into the interiors of the body. And because of that, nobody just jumps at ordering for it. There are, however, some situations when you may have to do an endoscopy, especially the doctor thinks that your ulcer might have developed some complications. For more on the complications, see my video on stomach ulcer, how bad it can get. Okay. In some settings, you'll be asked to do it once you have ulcer and you're around that kind 50 years and upwards. It get wide. Dr. Hedwig,
yes.
What about an ultrasound scan? Yeah, I'm aware of that. I know many people would have gone to a diagnosis center to have a scan done first before they even come see their doctor.
True.
Because they want to be sure they have a stomach ulcer. But remember what I said in the introductory video. The stomach is a bag-like structure, and like I illustrated, you would have realized that the ulcer, the wound we are talking about, is within the stomach, on the inside. So that means an ultrasound scan cannot see a stomach ulcer.
Oh,
the diagnosis
really?
cannot be made by doing a scan. Now, think of it, when we do a scan, we put a probe on the stomach and it tries to visualize the structure in your abdomen, So the best a scan would see is the outer portion of your stomach, like I was describing, the outer portion of the bag, but it cannot see the interior. So the best a scan would report is that there was probe tenderness in the region of the stomach where the ulcer pain is typically felt. Yeah, probe tenderness, I know I need to break that down. Probe is that thing we put on your stomach when scanning, and tenderness is the pain felt when something is touched. So doing the math, probe tenderness is the pain you feel when the person doing the scan touches your stomach with the probe. So an ultrasound scan, we suggest a stomach ulcer. It will not make the diagnosis. Like I have mentioned, the diagnosis is by an endoscopy. The doctor will ask you to do some additional tests in order to ascertain whether or not your stomach ulcer is caused by an infection. Yes, you heard me right. An infection. Surprise, surprise. It's essential to determine whether an infection is the cause of your ulcer, because if it is, there's a special way it will be treated. For more on the causes of stomach ulcer, see my video on how did I get a stomach ulcer when I eat a lot. For more on the special type of treatment you will need if your ulcer is caused by an infection, see my video on quick way to heal your ulcer. If this video has been helpful, kindly like it. If you are yet to do so, subscribe to this channel and turn on your notification so you can be reminded each time I upload a new video. Share this video with whoever you think might benefit from it. And don't forget, your health comes first.